Hello. Today we're doing our neurological assessment. Today, my stepmother will be playing my patient today, and we're just going to go ahead and perform a full neurological exam as if we would a patient who had possible a neurological disorder or emergency. So the first component of our neurological exam is to assess their GCS and their LOC. So how we would assess GCS and our LOC in our first component of our neurological exam, we will just go ahead and introduce ourselves to our patient like so. Hello, I'm Xavier, I'm with the ambulance.
Hello.
Nice to meet you, how are you?
Good.
Okay, so immediately as I was walking up, she was able to track me. She was able to shake my hand. So that just tells me right away that she is a GCS at 15. As well, when we assess our LOC, we want to go ahead and ask her ANO 4 questions. So that's person, place, time, and event. So I will go ahead and ask my patient. Hello, like I said, I'm Xavier with the ambulance. Can you tell me your full name?
Sabrina Lucero.
Okay. And do you know what time it is right now? Do you know
Around
like what day it is?
Sunday.
Okay, it is Sunday. And do you know what side of town you're on right now?
South Valley.
Okay. And do you know what holiday is coming up next?
Valentine's Day.
Okay. So she is ANO 4. She's able to tell me person, place, time, and event. She was able to tell me her full name, what time it was of the week, where she is at, and what holidays is coming up. So that's good. Also, we'll assess her mood. She doesn't seem to be combative or confused or anything like that. So we can go ahead and move on to our second component of our neurological exam, which is assessing the 12 cranial nerves. The first cranial nerve is our olfactory, which is smell. So I have this candle here, obviously, as if, in a real scenario in the back of the ambulance, I would have them smell an alcohol prep or something like that. And if they were able to smell it, that just tells me that the cranial nerve 1 is intact. But for this case, we have a candle. And I just want to make sure she can smell it. Are you able to smell that? Okay. She's able to smell that there is a scent there, so that's a good sign. Our next cranial nerve we would like to assess is our optic. By assessing optic, I want to check our to see if she's able to read things from afar. So I'll go ahead and have her read the words on this candle, basically. And it says peace, and yeah, just want to make sure she could read that. So are you able to read it?
Yes, peace.
Okay, yes. She's able to read it. So we'll go ahead and move on to our third cranial nerve, which is our oculomotor. By that, I want to go ahead and assess a pupillary response with a pen light. So just looking for pearl, if our pupils are equal and reactive to light. So go and look at my nose. They are equal and reactive, so now we can go ahead and move on to our fourth cranial nerve, which is our trochlear, and that's going to be assessed by doing the 6 cardinal gazes, having them look in the 6 cardinal gazes. So just go ahead and follow my pen without moving your head. Cool. She was able to follow the pen light as instructed, so that's a good sign. Next, we want to assess cranial nerve number 5, which is trigeminal. So just go ahead and clench your teeth for me. All right. She's able to do that. Next would be our abducens, which we already assessed doing the 6 cardinal gazes. Our next cranial nerve is our facial. So can you go ahead and give me a really big, exaggerated smile? Cool. She's able to do that. Our next cranial nerve is our vestibulocochlear, and we're going to assess if she's able to hear, essentially. So can you close your eyes for me? Where is that?
Left.
Okay. Where is this at?
Right.
All And what about now?
Both.
Okay. So she could hear on both sides. So now we could go ahead and move on to our next cranial nerve, which is cranial nerve number 10. So that's our vagus nerve. So can you go ahead and, I'm gonna assess a pulse, and I wanna feel her pulse drop while she bears down. So just bear down really, like you're flexing really hard. Okay. And we're able to feel the pulse drop. Our next cranial nerve is going to be cranial nerve number 11, which is our accessory. And by testing this, we're going to go ahead and have her shrug her shoulders. So go ahead and shrug your shoulders for me. Cool. And our last final cranial nerve is number 12, our hypoglossal. So go ahead and just stick your tongue out and go to the right with your tongue, to the left, and down. So cool. Our cranial nerves are all assessed. We'll go ahead and move on to our motor part of our neurological exam. So we're going to go ahead and assess arm drift. This is like a Cincinnati test essentially, where if there is a arm drift, it could be indicative of a possible stroke and stuff like that. So go ahead and close your eyes for me and put your arms up towards you with your palms up, and just leave them there for about 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Cool. You can go ahead and drop them. So there is no arm drift, and that's a good sign for us. But we are going to continue with our neurological exam with a Romberg's test. And basically with the Romberg's test, we're going to have her stand up and check for her coordination and balance. So go ahead and stand up for me, and I'll just give you like a couple nudges, but try to keep your balance as best as you can, okay?
Yeah.
Going to the other side. Cool. She seems to be pretty balanced to me and well coordinated. So this is going to lead to our, you can go ahead and sit down. This is going to be our next component of our motor, part of our neurological exam, and this is a Babinski's. What we're looking for in adults is just, we're going to basically kind of scrape the bottom of their foot with a pen or just something, the thin edge. And we're going to see if their foot goes down. In babies, usually a positive Babinski's is you're going to scrape the bottom of their foot, not with a lot of pressure, but you're going to see their toes flare out and their foot go up. So it's kind of opposite with adults. Alright, so just keep your foot relaxed. Cool. Now we can move on to assessing the muscle strength and muscle rigidity and the muscle tone. So go ahead and stick your arms up, and I'm going to push down in your arms, but don't let me. Okay, now same way but up. I'm going to push up, but don't let me. Okay, now you're going to stop me from going up. Alright, now I'm going to push down, but don't let me push down.
Wait, is he?
So I'm going to push down, yeah, but don't let me.
Okay.
Alright. Her muscle tone, muscle rigidity, muscle strength all seems good. So now we can move on to our fourth component, which is assessing our deep tendon reflexes. So the first one we'll do is the patella. And I'm just going to go ahead and grab the camera here because the view here is not really good. You're not going to be able to see a good reaction. So we'll do the patella. Cool. Next, we'll go ahead and do the Achilles one. And you're going to feel for the tendon about right here. All right. Our next cranial nerve, we'll go ahead and assess the bicep, deep tendon reflex. We'll assess the bicep one right here. And we'll go ahead and put the camera up for this one. So basically just gonna feel right here. And this is where the bicep tendon is going to be, and what we want to see is just like a little flexion of their bicep, and this might just pop up a little bit as well. All right. So that is, we got our patella, we got our bicep, we got our Achilles, and now we can move on to our tricep deep tendon reflex. So I'm basically gonna have her just kind of relax her arm. I'm gonna assess for the deep tendon right here. We'll go on this. We'll assess the deep tendon right here. It's gonna be a little bit above the elbow. We did see a slight response, so that's good. And now we just have the radial deep tendon reflex. So I'll just go ahead and kind of have her relax her arm while I'm holding it, and just going to be a little above, about right here is where the tendon should be. All right. So now we can go ahead and move on to our fifth component of our neurological exam, which is sensory. So basically we wanted to see if she's able to feel pain, if she's able to feel cold sensation, hot sensation, and just different types of pressure within her skin and whatnot. So go ahead and close your eyes. What finger am I touching?
Yeah.
All right. What about now?
Pinky.
All right, what about now?
None.
Okay. Now just keep them closed. So she's able to tell what finger I'm touching and what I'm not touching. So now we just want to go ahead and move on to, if she could feel the different types of pressure. So how much pressure is on your hand right now?
Like medium.
Okay. And what about now?
What?
Okay, so she's able to do that. Next, we're just going to go ahead and assess if she could feel hot and cold sensations. So in the back of the ambulance, obviously, I could give her a hot pack and see if she feels that, or a cold pack and stuff like that. But now, just for the sake of this, for the sake of what resources we have right now, I'll go ahead and use this candle, which should be cold. And I just want to see if she's able to tell. So how does that feel on your skin?
Cold.
Okay. I don't have nothing hot, but she's able to feel cold, so if she's able to feel cold, I'm sure she's able to feel a hot sensation as well. Just now, the last component is just I want to see if she's able to feel pain. So I'll just go ahead and pinch the patient. Nothing too crazy, but just make sure she's feeling the pain that I'm inflicting on her. So can you feel the slight pinch?
Mm-hmm.
And how does it feel? Does it hurt? Or
Slightly.
Okay.
Yes.
So she's able to feel the pain. I mean, I was purposely not trying to hurt her, but she is able to feel the slight pinch, and that's a good sign. And that is our neurological exam.